Mercy Health is a public health organisation that offers a range of services including acute and subacute hospital care, aged care, mental health and community care. The Health Independence Program, also known as HIP, runs in the Continuing Care Centre at Werribee Mercy Hospital. This is an outline of the organisational structure for Mercy Health. HIP falls under palliative care and subacute services. The program provides services to people in the City of Wyndham, which is a total population of 217,122. HIP offers the following services, and within the services lies a multidisciplinary team that includes occupational therapists, physiotherapists, dietitian and speech therapists. Meredith works as the community dietitian and her role is very diverse. She sees outpatients, runs education sessions, as well as conducts home visits for clients. This video will be discussing the project completed at Werribee Mercy, which involved the evaluation of the HIP stroke group nutrition activities developed by La Trobe students in 2017, and implementation of additional nutrition-related activities. The circuit group is a rehabilitation program which focuses on functional activities that helps clients achieve their goals. The shopping trolley and hide and seek activity are the activities that will be outlined in this project. The program management cycle was used to evaluate and plan effectively. The project involves 2 cycles to complete the intended outcomes. The needs assessment involved looking at why the evaluation was required. The comparative need was a transition from the stroke group to the group that now contains neurological conditions. The dietitian established the felt need as no evaluation has been done since the implementation 12 months ago. To plan the evaluation appropriately, the goals, objectives and strategies were explored to create action plans which in this case involved client and staff satisfaction surveys, observations of circuit group and discussions with staff. Surveys are provided to 6 staff members and 4 clients, which is outlined in the table. Results revealed that the current nutrition activities are not meeting the objective effectively, which is to increase nutrition knowledge. The dissemination involved providing infographics to HIP staff, discussing findings in a meeting, and providing recommendations based on the evaluation. The theory of planned behaviour is relevant as the behavioural intent and attitude concepts are addressed in the client surveys. The communication theory underpins the dissemination as there was a use of media and interpersonal interaction that allowed for immediate learning. The second needs assessment was completed by looking at the client's felt needs. Maslow's hierarchy of needs is applicable as the felt needs of the client have identified the relationship between them and the esteem and self-actualization levels of the hierarchy. The client suggested activities should involve hand dexterity, should be engaging and challenging, and that nutrition information on serve sizes and bowel health would be of interest. There is a waiting list currently for the circuit group, which is the expressed need. The planning stage involved careful consideration of client needs and how they can be addressed. The new activities added to the circuit group include Know Your Foods, Scavenger Hunt, and Nutrition Flipbook. Maslow's hierarchy of needs is relevant at this stage as the activities aim to provide clients with a sense of achievement after completing them. It also helps to build confidence as they are more challenging than the previous activities. The adult learning theory is based on the idea that adults are self-motivated and it is applicable to this project. Planning involved the consideration of client needs which were addressed in the following ways. Hand dexterity was integrated into the scavenger hunt activity as it involves the client to open 6 jars and containers to complete a nutrition puzzle. The Know Your Foods activity also requires the client to open a jar and pick out the activity card which will relate to the activity. The flip book was established on the basis that not all key nutrition messages can be addressed in activities. Therefore, 8 different resources for 8 different topics cover the areas of nutritional interest, which will include bowel health and serving sizes. Implementation of the amendments and new activities occurred from week 3 to week 5 of the project. The rationale model refers to exposure and the likelihood of behaviour change. The implementation of activities increases the client's exposure to nutrition information, which aims to increase nutrition knowledge and influence behaviour change, which is why the rationale model can be applied. Pre and post questionnaires were developed for the future evaluations of the activities. The last stage of the program management cycle involved dissemination of the project according to 3 ways: presentation to dietetic staff, discussion with the allied health assistants, and all relevant resources were provided on the HIP drive. Thank you.